How's everybody doing today? I hope you're having a great week. Been pretty busy myself. Been scanning a lot, getting ready for a number of presentations, and actually I've had so many good cases recently, I'm not sure which one to share with you first. But I came across this venous case in a patient that had chronic outflow obstruction that I found pretty interesting. So I thought I'd kind of put together this short case. Hope you enjoy. Quick patient history. The indication was progressive venous disease bilaterally. Well, the presentation was a 70-year-old male with a 30-plus year history of venous disease. He had a history of remote bilateral deep vein thrombosis. He underwent a right leg vein stripping procedure multiple times in the remote past. But he also now has a 2-month history of ulceration in the right gaiter region. So let's take a look at the images. Now I apologize, this was somewhat battlefield conditions. This person wasn't the most cooperative, not the most photogenic patient, but pretty much what we'd expect to find with his history of bilateral DVT. He had extensive chronic phlebosclerosis throughout. Take a look at that common femoral vein. We can see that sclerosis within the vein. Look at that common femoral waveform. Maybe a hint of respiratory phasicity, but certainly not really normal either. How about the femoral vein? Again, pretty much classic chronic phlebosclerosis. There was also axial deep venous reflux, actually bilaterally. So here's the great saphenous vein. Now this is approximately 5 centimeters from the junction. So I see flow towards the transducer in the proximal segment, flow away from the transducer, bidirectional flow. Pretty interesting. Gee, what's going on here? So here we're going to start at that common femoral, and now I'm going to rock into the saphenofemoral junction. But if you note, I have a spontaneous retrograde flow up into that saphenous vein, and I'm able to follow that into a pelvic collateral. So that's a large outflow collateral. That's virtually diagnostic of a proximal outflow obstruction. I'll let you look at that one more time. Very cool, huh? So let's go ahead and recap this venous outflow obstruction. In fact, this patient had a chronic right common iliac vein occlusion and really 2 outflow collaterals. We chased that common femoral proximally. The external iliac was also sclerotic but had outflow into the patent internal iliac vein. And again, as I showed you, he had retrograde flow down the proximal great saphenous into that large pelvic collateral. So I hope you enjoyed today's technical tip on venous outflow obstruction. You know what to do. Like, subscribe. We're always looking for suggestions, or if you have a case you'd like to put up, please contact us. Also, if you're in the St. Louis area, the Mercy Medical Center St. Louis Vascular Symposium, 20th through the 23rd. A fantastic meeting with incredible people. Please stop by. See you next week.